The second trimester of pregnancy occurs from week 13 until 28 of gestation. This period is often considered the most comfortable phase of pregnancy because symptoms such as nausea and vomiting usually decrease. Fetal movement, known as quickening, are usually felt by the mother at around 18 until 20 weeks of gestation. Maternal physiological changes become more apparent. The uterus enlarges and can be palpated above the species pubis. The abdomen becomes prominent and the maternal weight can increase gradually. Regular antenatal care during the second trimester is essential to monitor fetal growth, assess maternal health, and detect potential complications earlier.
Next is fetal development in month 4 till month 6, for the rapid growth and maturation, then skin sensory development with appearance of lanigo hair and hearing development, musculoskeletal movement, bones, continuous ossification, and active limb movement, organ system maturation with lungs developing bronchioles and early alveoli, kidney developing urine, and G1 tract starts of swallowing. And sex differentiation viability, external genitalia can be identified by ultrasound, and by 24 weeks, fetus approach borderline viability. Also, if you can see in the graph, there's also refinement of the CNS, eyes, teeth, palate, external genitalia, and ears.
During the second trimester, which spans from weeks 13 to 27, maternal physical changes become more apparent as the body adapts to support fetal growth. Compared to the first trimester, many women experience an improvement in overall well-being, with increased energy levels and resolution of nausea and vomiting. This period is often referred to as the most comfortable phase in their pregnancy. The uterus enlarges and rises out of the pelvis into the abdominal cavity, making the pregnancy much more visibly noticeable. After 20 weeks, fundal height in centimeters roughly corresponds to the gestational age, which is useful for clinical assessment. Skin changes become more prominent due to hormonal stimulation of melanocytes, resulting in hyperpigmentation such as linea nigra and melasma. Stretch marks may begin to appear as the skin stretches. Breast enlargement continues, with darkening of the areolas, and some women even may start to produce colostrum. Cardiovascular changes include increased blood volume as well as cardiac output, which can lead to mild edema or palpitations. Musculoskeletal adaptations, particularly increased lumbar lordosis, may cause back pain, and round ligament pain is common in the uterus as it expands. Finally, genital urinary changes include increased physiological vaginal discharge, known as leukorrhea, while urinary frequency often decreases compared to the first trimester as the uterus moves upwards.
So as you can see here, this is the common discomfort of the pregnancy in second trimester. There are 8 common discomfort, and in the other side is the management of the discomfort in the left side. So, and the management is in this.
What is quickening? Quickening is the first time a mother feels the fetus move, often in the lower belly near the pubic bone, but moving higher as the pregnancy progresses. And this usually occurs between weeks 16 and 22, but can be earlier and later depending on each person. So quickening can feel like tiny kicks, gentle tapping, popping bubbles, and fluttering wings in the belly.
During the second trimester, prenatal testing focuses on monitoring both maternal and fetal health. Routine tests include urine examination to detect protein, glucose, or infection, as well as fetal heart rate monitoring to assess fetal well-being. An important examination in this trimester is the anomaly ultrasound, which is performed between 18 and 22 weeks to evaluate fetal anatomy and growth. Screening tests are also conducted, such as the glucose challenge test to screen for gestational diabetes, and the quadruple screen to assess the risk of chromosomal abnormalities. In certain cases, special tests like amniocentesis or the glucose tolerance test may be performed, especially in high-risk pregnancies. Overall, these tests help ensure early detection of complication and support a healthy pregnancy.
Nutrition and lifestyle. Nutrient priorities increase need for iron, calcium, and protein, and then exercise, safe activities like prenatal yoga, swimming, and walking to help with sleep and energy. Hydration, importance of water to prevent dehydration and reduce constipation.
And these are the warning signs of the second trimester pregnancy in the woman. The first one is the vaginal bleeding that can lead into the placental abruption and also placenta previa. The second one is the sign of the preterm labor, such as frequent contraction, leaking fluid, and also the pressure before the need of the urgent care, because this is still the second trimester. And then the third one is the sign of the preeclampsia, such as the severe headache, vision changes, and also the sudden swelling, and then the risk factors that carried by the mother, and then the absence of the fetal movement, severe abdominal pain, and also the high fever and persistent vomiting.
During this period, patients should be encouraged to attend regular antenatal care visits and take prescribed supplements such as iron, calcium, and folic acid. Understanding normal body changes also helps reduce anxiety and improves pregnancy adaptation. Daily health practices are also important, including maintaining personal hygiene, engaging in safe physical activity, getting enough rest, and managing stress with family support. The second trimester is also a time to strengthen bonding with the fetus. Mothers can begin to recognize fetal movements and are encouraged to communicate with the fetus and involve their partner in pregnancy care. Proper education in this trimester supports maternal well-being and prepares the mother for this next stage of pregnancy.